Hello everybody. Sorry I look like crap right now. I keep getting this little threatened rain. If you can see that gray cloud behind me. It's drizzling on me, but it's blue everywhere else, so there's no rain out anywhere else. Anyway, this is going to be a video about my... Sorry, I have to get my hands free again. Sciatic nerve pain. This is ridiculous. I did not fall. I did not hurt myself. Rain drops keep falling on my head. Wait till the second I come outside. Sorry, it's going to be crappy filming for just a couple of seconds. Alrighty, I am legitimately hobbling like I have a broken hip, because that's what it feels like right now. I don't know if any of you all have had out there sciatic nerve pain, but it sucks. It is like immediate shooting pain straight through your lower back, through your butt cheek, one leg or the other, or even both, and straight down into your thigh. It even went so far as to be in my calf yesterday. I was not appreciating that at all. Give me a second, y'all. I gotta do something really quickly. This is very loud. I gotta pull the car off. My last window mount that I had from Walmart, this one, it broke. Basically the little adjustable gripper here that they have, where you can slide it back and forth to fit your phone in any direction. That part got locked open, so my phone would just fall out while I was driving. So that's why I've been making videos by hand. I apologize. I am, however, going to use this one because Walmart's very good about returning things. So I took it back with the, there it is right there. I took it back with the receipt, and they did let me exchange it. Thankfully, they had another one, because the first day that I got it, there was only one. So I wasn't really hopeful, but they did have it, and it's, I want to say it's like, I don't know, it's less than 10 bucks. As far as I can see. Anyway, as far as I remember, I'm getting old. I'm still deathly ill. I'm going to say deathly ill. I almost went and called an ambulance yesterday, guys. I'm not even playing. I was so sick in the morning because I had spent all night, literally all night, all through yesterday, puking until about noon. And I mean, there's nothing in my system. I couldn't keep anything down. Couldn't keep my blood pressure messing down. My blood pressure was really high. Just drama. But anyway, let's get back to the sciatic issues. I am leaving to put some gas into Mom's car right now. So give me 1 second to change this phone around. Alright, sorry about the superbly odd angle. And I am all sweaty because I am sick. It is actually overcast, so it's not really hot right now. But anyway, this is very simple to assemble. I highly recommend it. I didn't have a problem with it until the day I tried to flip my phone and my case are very big. If I had just used my phone in there without the big bulky case, probably wouldn't have had that issue. So I'm not going to blame it on the ONN brand. And I'm trying to use my thighs with my wholly ripped up jeans to get this out. And I don't know if I'll be able to. Alright, basically, it comes out of the box like this. It has a suction cup on there that can go on your dash or your window. And I said it before, these dashboards that Mom has and I have are very textured. So you don't have to do the old lick and spit thing. It just has a lever right here. You can see it by my thumb. Pardon my nails, I haven't done anything with them. You just literally push that down and it builds its own suction. And then it does swivel. Sorry, this is one-handed, y'all. It swivels this way, as well as opens up. I don't know if I can do this part with one hand, but it opens up this way wider, and also the bottom part to make it taller. On the very back, there is a button right there on the top. That helps you open the side to side. And then the very bottom button down here, sorry, it's that round one, that's what opens up the bottom edge. So you can fit pretty big phones in here. I'm using a Samsung Galaxy J7 Star. Might have said that backwards, sorry. But my case is pretty bulky around there. I can get it to hold it, but my mistake was that I tried to rotate it one day. I can swivel it, no problem. But I just tried to load it in here a different way. Shouldn't have done that. My fault. Stupid human tricks, but live and learn. So anyway, I'm going to put this in, and then I'll continue this part of the video. Alright, so basically all the assembly that you have, I had to prop the phone into a cup holder. Sorry, guys. Just take that film off. I have found that they stick better to the windows than, like I said, these textured dashboards. So let me see if it'll stick to the dashboard. It might in Mom's car. Nope. So the window for the win. And I can move that off to the side so it's totally out of my range of view where I need to see the road. I promise you I'll be back on camera shortly. I'm just trying to lock it in. There we go. So basically, let me make sure I got you guys facing the right way. All I had to do was just basically put the suction cup against the windshield and flip that down. And that's it. And then I'm just going to use the buttons to, which I can't do with one hand, but you can see right there. It's opening on its own. I didn't even have to do it. And then I can open it on this end with this other button. That's it. Very quick and simple. Mother Russia, love this model. And it does swivel all the way around, so you can keep your phone vertical or you can use it sideways. I chose this instead of the vent model, like I said in another video, because the vent models, and I do have a button on. Leave it to Jennifer to cut herself off in video. Do it all the time, don't I? Alright, so anyway, it does hold my bulky case and with the button in the back. So I don't think anybody would have a problem unless you've got some gigantic tablet thing you're trying to stick in there. Like, I know the old Note phones, I want one so bad. They used to be pretty darn big, so they wouldn't fit in this. But it is up and running, so I'm getting ready to drive to down the street here and get Mom's tank filled up because I've been using her car while she's been gone, trying to keep the mileage and the wear and the tear off the old one over there that I bought from her. But, yeah, anyway, so getting back to the point of the sciatic nerve pain. It's going to end up being a two-part video. I keep trying to make them separately. I've got to do something with these nails. They are horrendous. Like, nail salon lady's going to have a warrant out for my ass. I have to fight her off. I don't have the money for it right now. I'll do them myself. Now, it is jiggling, as you can see. It shakes a little with the road, but it's not horrible. I think if you were able to mount it on your dash, like maybe if you put something smooth down, like even duct tape, just to cover the texture, you probably would be able to get the suction cup to stick to it to where it would be a lot more steady, because on the window it has a huge curve in the arm, which is making it bounce whenever I go over bumps and things. But it's holding it. Anyway, Florida's just got bumpy roads, y'all. So, yes, I may look good on video, but I still feel like dog doo-doo. I am about 70% from where I normally am. No makeup, as you can see. I can't be fussed, as the British people say. I cannot be fussed to be bothered with it. I can't be asked. They say that too. They have some cute sayings. Anyway, I barely got any sleep. I think I got about 45 minutes last night. And that was after taking a whole Flexeril for the sciatic nerve pain, and my muscles were sore as hell, and my heart rate was really high yesterday, my blood pressure was really high, so I pretty much have laid down most of this week. So my only concern with this pain in my leg is I may end up going over to the doctor anyway, because as much when you lay down a lot, you have a chance of getting blood clots. And I'm not trying to Dr. Seuss you guys, but it's just a fact. So, I really am not digging the fact that I have this sciatic pain, which, if you guys don't know that, the sciatic nerve runs from your spine kind of down through your hips and down your pelvis and your femur bones and down your legs. And if it's irritated or anything gets injured around it or inflamed around it, it literally will send lightning bolt pain, and I am not lying, down your leg that will put you on your knees like, oh, Jesus. Okay, because I had it one time in my life. I am 45. I had it when I was 18 years old, carrying number one son, because I had him at 18. I had been at Busch Gardens the night before. We walked. I mean, we walked a lot. It was like a Halloween special thing. And let me let you know, I was fine all night. Walked all night. Next day, walked around fine. Just picked him up to go from the couch to, I think, take him across the room. And literally, I just got this, my back wasn't hurting or anything. I just got this sharp jolt, like the gods have just sent a lightning bolt down my ass to my leg. because that's what it felt like. And literally I buckled one leg and went to one knee and a foot, and thank God I didn't drop him. But it's like that. You have no time to react to it. So this is bugging me because I've never had it again at 18. Okay, that's almost 30 years ago. I'm 45, so give or take a few years, say 17. Sorry, 27. Yeah, I never had it again. Even after my car accident, I have some problems with the lower vertebrae. They're a little shifted. They're not bulging. The neck is, but not the lower vertebrae. And on top of that, it's been a lovely week because the bleeding has still not totally stopped. TMI moment. And that's 3 weeks now. It's almost done, though. I'm not worried about that. And then I kept having a stomach issue. Like I said, throwing up the day before yesterday all day, like every 20 minutes. I would take sips of water to try to stay hydrated, and I literally would puke it up in 30, 40 minutes with a bunch of bile, or stomach acid rather. And I'm assuming that's because, if you've seen my earlier videos, I had my gallbladder removed a couple years ago, and ever since then I've had this issue. Like, my blood pressure gets high, I get tons of stomach acid, get stressed out, get tons of stomach acid. Sorry, there's an ambulance going by. And then I end up vomiting for, like, sometimes a full day, sometimes 2 days. So I really wasn't so concerned about that part, but that doesn't let me keep my blood pressure medicine down. And not being able to keep, sorry, hiccups, not being able to keep my medicine down. Clearly I couldn't take anything for the hip pain. I do have Cymbalta, which a neurologist prescribed me a while ago. Bad patient right here. Because it's supposed to help with that, but it takes a couple weeks for it to kick in. And sorry, trying to get over. And I didn't ever take it because that is not a medication that they recommended to take if you're trying to conceive, which clearly you guys know it's been what is it, like 6 years? Should be about 6 years now, yeah, in a couple months. Anyway, so I didn't take it for that reason. I just kept the bottle. So the medicine is still good, but I have a feeling that that medicine is what made me sick as a dog. Not only was my heart rate high, I had tons of stomach acid, and I only took 1 dose. And I was sick every minute after that. I mean, in the bed. Seasick. Nasty. Like Gilligan's Island right before they hit the island. That minnow on the 3-hour cruise thing. So, anyway, this sciatic pain, please comment down below if you guys have any suggestions about it. I know if I go to a neurologist, they're probably just going to say, we'll give you a cortisone shot, which means a needle like that long. Can't even fit it on my phone, and they're going to stick it all the way up in my ass, because that's right where the pain is settled now. The only thing that I was saying earlier, because I always get off task, and Alicia loves these rambling ass videos I do, which I hate, but I can't get into this neurologist right back here any sooner than 2 months, so that's not convenient. I don't have a primary care still, because they keep assigning me one way far away, and the ones over here can't get me anytime soon, and I don't need them right now. But the thing about the whole, dude, I needed to turn there. Just people in Florida, you'll get there. Sorry. Anyway, I was having a moment. But my therapist says I'm much better now. All right. Anyway, the thing about the sciatic pain is I've had it, like I said, that one time. Generally, you can take some anti-inflammatories, like something simple, even like ibuprofen, and just rest. Well, I've been in bed all freaking week. I've been in bed, like, literally laid out, other than to get up, take the dogs out, or to feed my son. That's it. Or to cook dinner one time, because mom has been gone. So I haven't had to get up and do a whole lot. And every time I do get up, I'm like, okay, the pain went away. And about 5 steps later, it's like, oh, Jesus. And it feels like somebody took an ice pick and stuck it directly into your hip joint, like right where your thigh and your hip meet. And on my leg, it is just the left side. It's not bothering the right. It's not my lower back. It feels like it is in my left hip, specifically. Not in the ball joint, but left butt cheek going down to my knee nearly. And now it is at the point that it's been about 7 days. It has now reached where it feels like it is actually in my calf sometimes. That I don't like. Waggy finger. I'll tell you why. The more you lay in bed, like if you're in a hospital and you're going to be there for a while, I've been there as short as 4 days, and they have made me take a Levinox shot. Levinox shot is anti-blood clotting agent to make sure you don't get clots, because when you lay bedridden, you have a very high chance of getting a blood clot. Those blood clots, when they break loose off of a vessel wall, and you know, because you've been laying dormant and not doing much and not exercising, not moving around, they literally, think about your heart pumps and pumps again, like this. That's blood going in, out, in, out, in, out, just that quick. So for that clot to be even in your lower leg, it is a serious, serious thing for it to shoot straight up just that quick to a lung. A lung is a problem. That's a pulmonary embolism, and hate to be bitter, freaking Grim Reaper, but you're gonna die. If you don't get EMS to your house quick, fast, and in a god darn hurry, you gonna die. Especially if you don't get to that hospital, you gonna die. So, yeah, that's what my concern is now, because the pain has started as sciatic pain, but I bed rested because of all the illness and the sickness and the vomiting, and then the hip pain. I literally was in the driveway talking to Mr. Country earlier, which I have said to everyone, I don't want no visitors because I don't feel well. Leave me alone. But sing the Michael Jackson song and get a copyright violation. Anyway, I just wanted to be able to lay in the bed anytime I do not need to get up and do something, because I was trying to get over this stomach bug, all the other issues, the headaches, the migraine, and the hip pain to rest my hip. Well, he swung by earlier to bring me a card, which was very sweet. Thank you very much, because he does follow the channel. And so does his daughter now. Hi, Christy. And I don't have the card with me, but I was like, I could not even stand in my driveway and have a 5-minute conversation, because just those 20 steps it probably took me to get outside, answer the door, walk maybe another 10 to my car, and just stand there on 2 legs, just talking, just standing there. My leg felt like ice pick. Like somebody had it there and they were just twisting it, twisting it, twisting it. And the pain's just shooting, 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 shooting nonstop. It's not going away. So I did take a Flexeril muscle relaxer last night. I took actually a half of one, and then I took a half of another because I don't have many left. That seemed to help till this morning, but as soon as that wore off, this pain was right back. So that's probably what I'm going to end up having to go to the ER, or the doctor, to see somebody about. So anyway, that's all. I'm going to ramble by you guys for now, because this is going to become too long of a video. It's getting ready to storm. If I can show y'all that beautiful Florida sky is nice and blue, and then it turns to that. Yep, it's coming for us too. All right, I gotta get my button back out. Sorry. Anyway, guys, sorry about the long video. I do want to put up more stuff. I had another video for you guys on fertility ladies, TTC people, on the soft cup, which is a menstrual cup. I still haven't edited it because my record's skipping, sorry. Because I just don't know what I want to do with it so far. I'm trying to put a little more of the themes which are built into the program. So I apologize greatly to any of you who can't really see something clearly that's coming up in these slideshows, or these, what do they call them? Montages, yeah. The theme does not give me the option of changing the music. It just loops itself. It doesn't give me the option of volume on the music on this program. It does not give me a lot of choices. And it's a lot more tedious for me to do it all separately. And you can see what I look like right now. Ew, extreme close-up. That was like a horror film. Apologize greatly. So anyway, don't forgetting to, I can't even speak. Way to go, Jen. Anyway, don't forget to like, subscribe, hit the notification bell, and I will see you guys in the next one. Bye.